To improve the accuracy and reliability of the final volume measurement, we will look at steps that help the user identify and eliminate certain potential user errors. As seen in the video, use firm but not excessive pressure when applying the probe to the patient. This will significantly help the USCAN identify the bladder by locating the pubic bone. Notice in the second set of images that while only using light pressure, the pubic bone is not identified, and the bladder not detected appears on the screen. Angling the probe toward the patient's feet is important since the urinary bladder is partially located posterior and inferior to the pubic bone. When patients with a significantly high BMI number are being scanned, it is important to move excessive tissue away from the pubic bone. Like with all bladder scanners and ultrasound machines, the excessive tissue, scar tissue, and bowel gas will limit sound travel to and from the desired location. To avoid the greater than sign, center the probe to the urinary bladder as much as possible. By doing this, it will be much easier to pass through the entire bladder with the fanning motion and greatly reduce the possibility of cutting off either lateral aspect of the urinary bladder. Because of the rather slippery nature of ultrasound gel, it is possible to produce a sliding motion from side to side. Avoid sliding the probe, as this will cause the scanner to duplicate the bladder walls and/or calculate a volume larger than intended. Often the USCAN will detect that the probe was moved off center and slid from the original starting position. Make certain to complete the fan through the entire bladder on both the right and left lateral margins. If the last image in the sweep contains an image of the bladder, as in this example, the USCAN will assume you did not pass all the way through the bladder and give the greater than sign. We are opening the file that the USCAN recorded during the last bladder volume scan. Although this is not something that you need to do, we are just demonstrating that the USCAN requires the user to pass through the entire bladder to obtain an accurate volume measurement. Notice that the sweep from the scan passes through the entire bladder on both lateral margins. Of course, this is very easy to do when the bladder is in a low volume state. More care will be needed when the urinary bladder is in a higher volume state, as seen in this video. In conclusion, the USCAN is a unique product when compared to all other point-and-shoot bladder scanners. The USCAN is easy to use and guides the user through each step along the way.